In her video, What is Schizophrenia? It's More Than Hallucinations, Dr. Tracy Marks describes schizophrenia as the most dangerous diagnosis in psychiatry because people can't tell what is real and what is not. See, schizophrenia, schizoaffective, and schizophreniform disorders, they may only affect 1% of the population, but they're still considered, according to the National Institute of Mental Health, it is still one of the top 15 leading causes of disabilities. So even though it only affects 1% of the population, it's still a big deal. And to better understand what is schizophrenia, we have to first understand what is a psychotic disorder. And a psychotic disorder is a mental state where someone's sense of reality is altered. And in this state, a person cannot differentiate what is real and what is not real. See, they're experiencing the world, they're experiencing their environment very different than a normal person does. And in this psychotic disorder, they have a couple of symptoms, and these are their manifestation of hallucinations. So in their perceptual occurrences, they're seeing things or they're hearing things that are not there, or they're having delusions. They're having fixed false beliefs that no matter how much evidence someone gives to them to try and to help them understand that what they believe just can't be accurate, they just can't grasp it. They have disorganized thinking, also called thought disorder, or they're grossly disorganized, or they have negative symptoms. And this negative symptom category is where I think of the Joker on Batman, and that for out of nowhere, for no apparent reason, would just start hysterically laughing. And everybody around him will look at him like, what is going on with this guy? And that's kind of exactly what a negative symptom is. It's someone could be laughing for no apparent reason out of nowhere. They're not thinking of a funny joke, or they're not remembering a cat video that they watched. They're just, for no reason, at that point in time, they're just bursting out in laughter. And that's just one example of what a negative symptom is. But to be classified as either schizophrenic or having schizophrenia or schizoaffective or schizophreniform disorder, you have to have at least two of these psychotic or these psychoses manifesting themselves at the same time for at least 1 month period. And that's how we differentiate the three of these disorders. That's how we differentiate schizophrenia, schizoaffective, and schizophreniform disorder, at least on the base level. The first is by duration. So if you have schizophreniform, this would be where you've shown signs of at least two of these psychoses for at least 1 month to a 6-month time period. That is schizophreniform diagnosis. If someone then is above that 6 months of showing these symptoms, then they would be considered schizophrenic or schizophrenia. Of that, to be schizoaffective, this is when we actually attach a mood disorder with a schizophrenia diagnosis. In this, it's typically either bipolar or depression that we attach with it. And in this, someone with schizophrenia is also having a state of altered emotions, or their thinking. So it's altered emotions along with their thought processes. So that's how we differentiate the three of them. But then we look at things like modifiers and specifiers, and what do they do into a diagnosis? Well, first of all, when we look at them, we look at, as a provider, when we specify them, it gives us more of an idea of how we're going to treat a patient. So these modifier and specifiers, if we look back at the old coding specifics in ICD-9, when we looked at ICD-9, a provider could bring someone in for observation, bring a patient that's entered into the hospital for observation. They could then admit the patient into an observation unit, and they could give something like mental health. They could just say mental health. And under ICD-9, the old ICD-9 coding, that was okay. But when ICD-10 was first implemented, and 2013 was when it started to become, or when the United States said, ICD-10 is what we're going to start using in our coding, and it has to be, everybody has to be doing this at least by 2015. With ICD-10, these codings became a lot more specific, and we started seeing these specifiers. We started seeing things like, for example, like someone with ADHD, that they would break down, the specifier would break down the ADHD diagnosis further. So a patient may be diagnosed with ADHD with a predominantly hyperactive impulsive presentation. See, the specifier makes the diagnosis more specified. Pretty simple from that. And a modifier comes in, and it then modifies what that diagnosis might be. So for example, with this, if we had someone that came in that was had schizophreniform, let's say we diagnosed them with schizophreniform because we haven't observed them for a complete 6 months, but they're showing 2 signs of psychosis, then we could put a modifier on there that was provisional. So the provisional modifier would mean something like, hey, this is what our current diagnosis is, but as we observe them a little bit longer, we may change our diagnosis, in this case, from schizophreniform to schizophrenia. So the modifier just allows us to be able to be more specific, but also to change a diagnosis as more symptoms or more time, a duration comes about here. And in this too, with both modifiers and specifiers, it allows us providers to be able to create treatment plans that are more specific to a patient. It allows a patient not to be just generalized as being, let's say in this case, as having schizophrenia, but we can be more specific with the patient. And so they're not being lumped into a massive category that all these people get treated in one specific way, but we've actually identified more of their issues, more of their diagnosis, so that we can better create treatment plans and come up with even the medication that might be best for them. So when we're identifying a patient or when we're working with the patient, we want to look at a couple of things, especially with schizophrenia here that we're talking about. We want to look at, do they present 2 signs of psychosis for at least 1 month? And if they do, then we can at least know that they have schizophreniform. And then once we have that, we can start modifying and specifying their diagnosis to better help treat them, to help them understand what it is that they're going through, so that we can better get the patient the help that they need.